Clomipramine, also known as Anafranil, is a medication used to treat obsessive compulsive disorder, OCD. It helps to reduce unwanted thoughts and urges to perform repetitive tasks that interfere with daily life, such as hand washing or counting. This medication belongs to a class of drugs called tricyclic antidepressants, and it works by restoring the balance of certain natural substances in the brain, such as serotonin. The usual starting dose of Anafranil for adults is 25 mg a day, gradually increasing to a maximum of 250 mg a day. It is usually taken in divided doses throughout the day, and it is best to take it at the same times each day. Always follow your doctor's instructions for the best results. Before taking Anafranil, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor. To lessen side effects, it may be started at a low dose and slowly increased as your body gets used to it. After reaching the best dose for you, it can be taken once daily, usually at bedtime. Follow your doctor's instructions carefully, and do not take more or less medication than prescribed. The dosage is based on your medical condition and response to treatment. Use this medication regularly in order to get the most benefit from it, and do not suddenly stop taking it without consulting your doctor. It may take 2 to 3 weeks or longer before the full effects of this medication are noticed, so inform your doctor if your condition lasts or gets worse. Avoid eating grapefruit or drinking grapefruit juice while using this medication unless your doctor or pharmacist says it is safe to do so. And remember to take it at the same times each day. Common side effects of Anafranil may include dizziness, drowsiness, dry mouth, constipation, stomach upset, nausea, vomiting, changes in appetite/weight, flushing, sweating, tiredness, and blurred vision. It's important to note that anxiety symptoms may temporarily worsen when you first start taking Clomipramine. To minimize the risk of dizziness and lightheadedness, it's recommended to get up slowly when rising from a sitting or lying position. If you experience dry mouth, you can suck on sugarless, hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. To prevent constipation, it's advised to eat dietary fiber, drink enough water, and exercise. In some cases, a laxative may be necessary, and you should consult your pharmacist to determine the right type for you. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. However, you should tell your doctor right away if you experience any serious side effects, such as mental/mood changes, enlarged/painful breasts, irregular menstrual periods, or severe abdominal pain. Anafranil may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. It's important to seek medical help immediately if you develop symptoms such as fast heartbeat, hallucinations, severe dizziness, or unexplained fever. Additionally, seek medical help right away if you experience very serious side effects, including chest pain, seizures, or vision changes. It's also important to note that a very serious allergic reaction to this drug is rare, but you should seek medical help immediately if you notice any symptoms of a serious allergic reaction. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you experience any side effects, it's important to contact your doctor for medical advice. Antidepressant medications like Anafranil are used to treat conditions such as depression and other mental or mood disorders. These medications can help prevent suicidal thoughts and provide other important benefits. However, it's important to note that a small number of people, especially those younger than 25, who take antidepressants may experience worsening depression, other mental or mood symptoms, or suicidal thoughts. It's crucial to talk to your doctor about the risks and benefits of taking antidepressant medication, especially for those younger than 25, even if the treatment is not for a mental or mood condition. If you notice worsening depression or other psychiatric conditions, unusual behavior changes, or other mental or mood changes such as new or worsening anxiety, panic attacks, trouble sleeping, irritability, hostile or angry feelings, impulsive actions, severe restlessness, or very rapid speech, it's important to tell your doctor right away. Be especially watchful for these symptoms when starting a new antidepressant or when the dose is changed. As for the daily dosage and optimal timing for taking Anafranil, it's best to follow your doctor's instructions. They will determine the right dosage for you based on your condition and medical history. It's important to take Anafranil exactly as prescribed and at the same time each day. This will help maintain a consistent level of the medication in your body, leading to the best results. Before taking Anafranil, it's important to tell your doctor if you are allergic to it, other tricyclic antidepressants, or if you have any other allergies. Also, let your doctor know about your medical history, especially if you have any of the following conditions: bleeding problems, breathing problems, glaucoma, eating disorders, heart problems, intestinal problems, liver or kidney problems, mental/mood conditions, history of serious reaction to certain medications, seizures, overactive thyroid, trouble urinating, or any condition that may increase your risk of seizures. Anafranil may cause a condition that affects the heart rhythm, so it's important to talk to your doctor about all the drugs you are taking and any medical conditions you may have. Low levels of potassium or magnesium in the blood may also increase your risk of this heart rhythm condition, so be sure to discuss this with your doctor as well. This medication may make you dizzy, drowsy, or temporarily blur your vision, so it's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do it safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially bleeding, confusion, dizziness, and heart rhythm issues. It's important to be cautious and discuss any concerns with your doctor. During pregnancy, this medication should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding while taking this medication. If you are planning pregnancy, become pregnant, or think you may be pregnant, immediately discuss with your doctor the benefits and risks of using this medication during pregnancy. One important thing to note about Anafranil is that it can interact with a wide range of other drugs, possibly changing how they work or increasing the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, and to discuss this list with your doctor and pharmacist. In particular, certain drugs for high blood pressure, digoxin, thyroid supplements, and other drugs that can cause bleeding or bruising may interact with Anafranil. It's also important to avoid taking MAO inhibitors during treatment with Anafranil, as this can cause a serious and possibly fatal drug interaction. Additionally, the risk of serotonin syndrome or toxicity may increase if you are also taking other drugs that increase serotonin, such as certain street drugs, St. John's wort, or certain antidepressants. Before using Anafranil, be sure to report all medications you are currently using to your doctor or pharmacist, as many drugs can affect the way Anafranil works. Finally, if you smoke or have recently stopped smoking, it's important to inform your doctor, as cigarette smoking can decrease blood levels of this medication. If you or someone you know has taken too much Anafranil and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek emergency medical help right away. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an Anafranil overdose may include a fast or irregular heartbeat, severe dizziness, fainting, delirium, seizures, or loss of consciousness. It's important not to share Anafranil with others. Your doctor may request lab or medical tests such as EKG, liver function, and blood counts while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Anafranil, take it as soon as you remember. However, if it's close to the time for your next dose, just skip the missed one and take the next dose as scheduled. Don't take a double dose to make up for the missed one. Remember to take Anafranil at the same time every day to maintain a consistent level of the medication in your body. When it comes to storing Anafranil, it's important to keep it at room temperature and away from light and moisture. Remember not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of any unused or expired Anafranil, make sure to do so properly. Avoid flushing it down the toilet or pouring it into a drain unless directed to do so. Instead, consult with your pharmacist or local waste disposal company for the best way to discard the medication. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.